joint in your entire body. It has the most surface area articulation of any other joint. It is one of the most complex joints in your entire body. There are a ton of different structures that we're going to go over, different ligaments that attach and anchor the femur onto your tibia. And it is primarily considered a hinge joint. That is the classification that we're going to go with in this class. It is considered to be a hinge joint. If we look at the structures, this is an anterior view. This is the tibia, this is the fibula, and this is the femur. They're enlarged femoral condyles that articulate the tibial condyles. So these are your femoral condyles. These are your tibial condyles. The medial and the lateral tibial condyles have a medial and lateral tibial plateau. So it's the top part of the condyle, that surface area that's on top. That's called a plateau. And that is the receptacle or the receiver of the femoral condyles. So they are there meant to take the load from the femoral condyles. The tibia is more medial than the fibula, and it is our weight-bearing bone of the knee. Does the fibula actually articulate with the femur? No. It's not. It doesn't. It doesn't actually touch the femur. So the tibia is your weight bearer for the knee. The fibula has a function though. It's lateral, and it serves as a point of attachment for a lot of your knee and knee structures like knee muscles or ankle muscles will attach there, ligaments and tendons attach there. So it serves as a point for which other structures coming from the knee are going to articulate and attach to it. And that's really its main function at the knee, is to serve as a place for muscles and ligaments to attach. It does not articulate with the femur or the patella, and it is not considered to be part of the knee joint. The patella, we looked at the front view, right? So if we have our knee, the patella sits right here in the front. This is sagittal view. This is the patella. It articulates with the femur. There's a little fossa right here, the patellar fossa, the patellar groove on the femur, and that's where it sits in. It's embedded in your quadriceps tendon. So the tendon that comes from your four quadriceps all point together. So they all come in, all four come in, and they serve this little white part right here. It's called your quadriceps tendon and your patellar tendon. That is where the patella sits. So it kind of floats inside the tendon on the posterior side. This is the tendon. It's on the posterior side, just anterior of your femur. It serves as a pulley system. So if that were not there, if this were not there, and we remove that, what happens to the distance between this axis and this muscle? What happens to the distance if we got rid of this? It shortens. So you're shortening the moment arm for the quadriceps muscles if you were to get rid of this. So having this bone here increases the distance, and it helps the tendon wrap around, your quadriceps tendon wrap around where it inserts on the tibial plateau right here. It is increasing your moment arm. It's serving as a pulley system to increase your mechanical advantage of your quadriceps muscles. Like that. The mechanical advantage of the extension of the quadriceps muscles. The actual name for your knee is going to be, the joint is actually considered the tibiofemoral joint. That is the knee joint proper name. Knee joint proper. The proper name for the knee joint is tibiofemoral. So the tibia and the femur. It's classified as a hinge joint. However, it has been argued to be also, the other argument is a condyloid classification. And we'll see why that is in a minute when we talk about not only does, so how many degrees of freedom does a hinge joint have? 1, 2, or 3?
One.
Oh,
One.
shoot, sorry.
How many classifications does a condyloid have? One, two, or three? Two. So it's argued that this joint can actually, it does actually move in two planes, but it's considered a hinge joint. We consider it a hinge joint because the second plane that we're going to learn about that it moves in is a function of something else. It's not really intentional, and it just happens because of some other mechanism that's occurring, that's going on. So there is an argument to be a condyloid classification. However, the knee joint proper classification is still a hinge joint, and that is how you should know it in this class. 1 degree of freedom hinge joint. It is sometimes referred to as a condyloid classification because it does have the ability to do internal and external rotation. And we'll talk about that in a minute. So this is the knee joint proper. Tibia femoral joint. It is a hinge joint, 1 degree of freedom. The second part, the second joint that's associated in the knee area is the patellofemoral joint. So this is where the patella sits on the femur. This is a gliding joint because the patella just sits right inside the tendon, right on top of the femur, and it just glides and moves around. Gliding joints have how many degrees of freedom?
0. I mean,
3.
3, sorry.
3.
But they don't have any rotation.
What was special about them? No rotation.
Yeah, no
right?
rotation.
No rotational degrees of freedom. It just floats around. It doesn't actually rotate around anywhere. Gliding nature of the patella on the femoral condyles. It just sits right in between the condyles and it just floats around. So it's a gliding joint. Let's talk about our ligaments.